When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts. Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary.
Attach pads firmly to person's chest as shown.
Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. However, adult AED pads can be used on a child if pediatric AED pads are not available. If the pads touch, which is usually the case with small children and infants, place one pad in the middle of the chest and the other pad on the back, between the shoulder blades. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say, "Clear," in a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say, "Clear," in a loud, commanding voice. Push the shock button to deliver the shock.
Shock delivered.
After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while Responder 2 sets up the AED. When the AED prompts, analyzing heart rhythm, Responder 2 says, "Clear." Then the responders switch roles. Responder 1 will now operate the AED, and Responder 2 will now provide CPR. The responder should switch roles in this manner each time the AED analyzes the heart rhythm. Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are increased.